distinguished guests, and my fellow pulmonary patients and other disease patients. What a wonderful day and a wonderful place to be. It's very humbling for me to stand before you today and share my story. First of all, I'd like for everyone to take a big deep breath and hold it. Exhale. Have you thought about the air you breathe today? Well, someone with fibrosis in their lungs of any type is thankful for every breath they breathe. I have idiopathic pulmonary fibrosis. I'm not a doctor or a specialist in the medical field. I'm a patient who's learning just like you. I know the air sacs and blood vessels in my lungs carry oxygen to the organs in my body, the heart, the brain, your muscles, and as a result, they do not get the oxygen they need if you have pulmonary fibrosis. To tell you the truth, I hated my oxygen. I had to be convinced by my doctor and Catherine Lindell that it was medicine. So don't fight it. Just go along with life and enjoy it. I'm thankful today that I can breathe without oxygen. I had a single lung transplant 11 years, 5 months, and 10 days ago. Thanks. I still have IPF in my right lung, but the last test showed that I was breathing 87%, and I think that's pretty good with one lung with crackles in my right lung. As many as 200,000 people in the United States, 5 million worldwide, have pulmonary fibrosis, and that only represents the number who have been properly diagnosed. In many cases, doctors cannot or won't refer their patients for proper diagnosis. I had never heard of pulmonary fibrosis, and neither had my local doctor until 2002 when I started getting short of breath. Back then, my husband Paul and I were having the time of our lives. He worked at the health department, and I worked for USDA, the Farm Service Agency, in my county, and I worked with our employees group on a national level, so we traveled all over the United States. And I'm thankful we had that opportunity before we both had to retire. But in September 2002, I was walking down the street in San Antonio, Texas, with a friend of mine, and she said, "Charlotte, why are you breathing so hard?" I kept getting short of breath that fall, more tired, and having severe migraines. I had no cough, like many of you do. That winter, I had a very bad cold that I couldn't shake. In February, on February the 7th of 2003, after going to the office and doing payroll, because no one there could do payroll but me, I went to the hospital, and my pulse ox was 52%. I was immediately put on oxygen for pneumonia, and my doctor did not refer me to a pulmonologist. Then the blessing happened. Our county was hit with the ice storm of the century. The hospital even had to close. So I was transported north to a hospital about 55 miles away. First time I'd ever been in an ambulance. I was healthy. The pulmonologist there asked for all my records, and after a week evaluation said, "We need a cutting." And so then he transferred me back to Charleston, which was 50 miles south of my home. And he said, "It's not pneumonia, but I'm going to refer you to Dr. Gray in Charleston, West Virginia." By the way, ladies, Dr. Edward Gray looks exactly like Richard Gere. Dr. Gray did an examination, and he said that a surgeon would be doing a lung biopsy, and of course my diagnosis was IPF. Dr. Gray knew the doctors at the Simmons Center in Pittsburgh and told me he wanted to get me in the system. I received excellent care, but was very weak. I had been in 3 hospitals in 32 days. Then I was sent home on March 10th, 2003, followed by the oxygen company. A month and a half later, I met with Dr. Kevin Gibson, who has been on one of the panels, and Kathleen Lindell, also on one of the panels from the Simmons Center in Pittsburgh. We don't have any facilities in West Virginia who could do lung transplants. My sister and husband were thrilled that Dr. Gibson said I would be a good candidate for a transplant. I was devastated. I had not admitted till then that I was dying. I cried for 3 days, and then I thought, I've got to have a positive attitude here. The thought that bothered me the most was someone was going to have to give their life for me. But I kept busy. I started pre-transplant rehab 3 days a week, which I feel any rehab is important. I attended the Simmons Center support group meetings in Pittsburgh, 4 hours away, every month. And then I had my transplant evaluation in August of that year. I went to my office a few hours a week, worked at my church, instructed ritual work in Eastern Star, and did family activities with my oxygen. In October, my rehab nurse told me that my pulse ox was dropping. I had 2 more trips to Pittsburgh, and on Christmas Eve, I received a call and said, "We flipped the switch, get ready." I spent Christmas Eve packing. I put my beeper on, had a cell phone on me at all times. Clothes and money were in the car, so I would be ready when I got the call. That winter, I felt like my life was passing me by. However, the blessings I received were unreal. I received cards, emails, notes from all over the country. I received visits from far away as Illinois. I always seemed to have the right doctors and nurses, and I was never a taker. But I learned, I was always the giver, but I learned people were going to give it to me anyway. These things kept reminding me to be positive. But I told my husband in May of 2004 I wouldn't make it to the 4th of July. I could feel my body giving way. So I always say I had the fast-moving kind. On June 4th, we received the call, and it was a crazy trip to Pittsburgh. We made it in 3 hours, but we always allow ourselves 4 hours. But that's another whole story, and sometime I'll have time to tell you that. The surgery was successful. Paul forgot to call anyone at home, because sometimes you go to Pittsburgh and they always have someone standing by, plus sometimes it's a false alarm. But by the time I got out of surgery, my brother and sister-in-law were there, and I was in the hospital for 8 days and then released to go to the family house nearby to recover. I had to stay up there 2 months. The first day there, I went to the exercise room and walked on the treadmill 1 minute. That's all I could walk. The next day, 3 minutes. The next day, Mother and I walked down the street for lunch. The 4th day, I went to my doctor, and he said, "What in the world have you been doing?" Well, I told him. He said, "Well, just keep doing it." After about 3 weeks, I developed a severe infection, and I almost died, but it had nothing to do with my lung. I went home after 2 months. I did have a clipped vocal cord that I needed surgery in September, and my kidneys have been affected by the anti-rejection medication. I had some depression that winter, for I couldn't do everything I wanted to do. I was always hitting the ground running. But in July, I got to go back to work. I was so happy, but then, that was in July. In September, I developed tremors from my Prograf, my anti-rejection medication. Thinking I was in latter stages of Parkinson's, I took the buyout offered by the federal government in November with 30 years service. Is everything a bed of roses after transplant? Let me ask you this. Is everything a bed of roses for you in your life? Not in mine. For example, just in the past 3 years, I've lost both my parents. My husband's in an assisted living for severe Alzheimer's. I was in a car accident where both ankles were crushed, and I lost my mother in that wreck. And after 3 surgeries, I was told I may never walk again. I had a knee replacement in July of 2004, and I broke my wrist this past May. I used to go to the doctor once a year, but now I go to my pulmonologist in Pittsburgh. I have PFDs. I have blood work every month. I go to my kidney doctor, my neurologist, my dermatologist, my dentist, and my eye doctor more often. But everyone jumps through hoops in their everyday lives. I did have some problems, but I have had no infections and no rejections in my lungs in over 11 years, and I'm thankful. So where's my journey taking me now? My motto is, today is the first day of the rest of my life. I've been given a second chance at life, and I'm going to take care of this gift that I've been given, not only for myself, but so that I can help others in any way that I can. I want to give others hope. I truly believe that God will put me where He can use me. First and foremost, I follow my doctor's orders and their prescriptions. When I'm traveling, my traveling companions know where my medication list is and what I cannot take. I'm active in my church again, the Order of the Eastern Star. I'm doing things with my family. As a matter of fact, you won't believe this, but 3 years ago, it's on my bucket list. My nieces and I went parasailing. And a few weeks ago, I went four-wheeling with my friends and family. I've been given the opportunity to do so many things different than before. I helped start a caring network for our IPF support group in Pittsburgh. My license plate reads, "Organ donors save lives." I volunteer and speak about organ donation. And as Dr. Kay said, I am a Pulmonary Fibrosis Foundation ambassador. And they both provide unparalleled support and resources. Both projects are very, very dear to me. Do I miss my past life? You bet I do. But I believe that either you control your attitude or your attitude controls you. Don't be so busy counting your problems that you forget to count your blessings. I want to thank everyone present at this summit for their support, their concern, their research, any part that you've had in this summit to alleviate this terrible disease known as pulmonary fibrosis or other interstitial lung diseases. My journey continues. I still have IPF in my right lung, so I still need your support. How can you help the Pulmonary Fibrosis Foundation? There's information everywhere on your tables. There's information that has been given here at the summit. You're going to get slides from all the information that's been passed out and talked about. Make yourself familiar with pulmonary fibrosis so that you can make others in your community aware. Our mayor in Ripley is a female, and she and I had our picture taken, and she declared September Pulmonary Fibrosis Foundation Awareness Month. I went to Virginia to speak, and when I got back, there were 3 people who had called me said they had the symptoms. See what a small thing that would touch some other people. Get involved. Stay involved. Keep coming to the summits. Go to support group meetings. I could go on and on and on with my journey. But when I'm asked to speak before a group like this, I always close with this. For I try to live by this every day of my life. Go share with a sister or brother thy bread, for giving is living, the angel said. But must I be giving again and again? My peevish and pitiless answer ran. Oh no, said the angel, piercing me through. Just give till the master stops giving to you. Thank you. May God bless you. Thanks everyone who's doing anything, who has done anything in planning this summit. I think it's been a fantastic summit. And remember, patients, there is hope out there. Thank you very much.